dispatched to a cardiac arrest. So we get to the house and we have a gentleman that's down on the floor, and he's, the wife said she saw him go down. He's not breathing and has no pulse. So, all right, so when we get there, we'll check him, we'll check for a pulse, we'll check to see if he's breathing, he's not breathing. So then we're going to start from there. So he is not breathing. Okay. So, all right, somebody's going to start breathing for him, okay? He has no pulse, so we're going to start CPR. All right, CPR is in progress. All right, we're going to get him on all our equipment, which is the monitor. This is set up for the air. We're going to get an IV, so get some IV stuff. LT, if you want to do the IV, I'm going to get him on the monitor and pads. We're going to get the monitor on. Okay. All right, good job. With CPR, obviously, you're going to be doing fast compressions. Okay, we're breathing for him, getting everything on. We get an IV. Okay, we can do two ways of IVs, going in through the arm, or we can do what's called an interosseous. So
I'm going to need someone to back for me too, guys, so I can get my tube all set up.
okay, alrighty. So let's get the tubing stuff up here.
It's right here.
You got it there? Okay. Alright, so if you bag, alrighty. Alright, so with these we can see what rhythm he's in. It was unwitnessed, so we're going to do CPR for 2 minutes. Well, actually, we can't. Okay. We're going to get equipment ready to tube the gentleman so we can get a good airway down there and breathe for him. Alrighty. Are we doing PFib? Okay. This is all for training purposes, all our equipment. This is all training equipment.
Ready?
So, okay. So he's going to be like in a rhythm that we can shock. Okay. So we have everything attached for him. We're having somebody tube for us, can breathe for us.
Ventilation again?
Okay. Okay. He's going to be in a shockable rhythm, so we're going to have everybody stand back. We're going to check, see if he still has a pulse. He doesn't have a pulse. He's still not breathing. We're in VFib, so we're going to charge. We're going to get everybody to clear away from the table. Clear, everybody clear.
Everybody clear?
Clear.
And then we're going to shock. So that will shock the patient, it'll shock that rhythm. We go straight back into CPR again. We can just put the tube in, we get drugs out, we can put drugs in.
We're going to try again.
We have, what we've done is we've drilled into his legs so that we can put drugs through the leg. So we're going to have some epi, so we're going to draw up some epinephrine, we're going to give him some drugs. By this time we'll be getting things ready to load him onto a backboard to carry him onto the stretcher to the hospital. Things happen very fast, they happen very fast in the field. He'll have a definitive airway in, so somebody will be breathing through a tube.
What is a definitive airway?
The tube is going down into the lungs so we can breathe for him.
Oh,
so,
that will be in constantly?
Yes.
Excellent.
Yeah, so you can take a picture of the tube.
Mm-hmm.
It's the tube she's doing. So.
Epi's in.
Okay, right, good.
Sorry, sir.
You do this in 2-minute increments. We'll be doing the CPR. Once she has a line in, airway tube in, then we can breathe through him through there. But just that's good. All right.
Okay, visualized it?
Yep, going through the tubes. Okay, back him.
Wait a minute.
If it's in the lungs, this will reinflate. Okay. And he has, good lung sounds.
Chest rise.
Equal chest rise and fall. Okay, resume CPR. So these will go in like 2-minute cycles.
Mm-hmm.
We'll keep the CPR going, giving drugs, take him to the hospital, get him to the hospital in a timely fashion. So we have a backboard over here. to show you. I'll pull this over. He'll be loaded onto the backboard.
Strapped in.
Yeah, strapped in so that we can carry him to the. 2 more minutes. We're going to check for a pulse again. Everybody stop what they're doing for a second.
Still appears in VFib.
Okay. Still no pulse, still not breathing. Then we're going to shock again. Okay, everybody clear.
Charging.
Charging. Clear. Everybody clear.
Everybody
And
clear?
then shock. Yeah.
Shock.
And then straight back into CPR again. We'll be giving more drugs and loading him up. So,
Excellent.
And the drugs themselves change with each course.
right.
So really,
We have certain drugs that we give initially, then we have a secondary drug that we give, and depending upon what his heart does or the activity does within his heart is which drug we give. So
Excellent.
we have the ability to change as things change.
very cool.
So with some people with these rhythms, we can actually get them back so their heart is beating. We can get them back and shock them back into a rhythm. So in which case then, everything changes again. So,
And all of this is standard.
yeah.
If you have a cardiac arrest, a code blue inside a hospital, we treat them no different than any hospital setting or any other trained professional at our level would, as well as emergency room physicians. They run the exact same medicines that we do. The exact same treatments are given by an emergency room physician that we would give pre-hospital out in the field.
Awesome.
All right. So we load him up on the backboard, get him into the rig. All this would continue all the way to the hospital.
Or until you see results, right?
Right.
Whichever
Or
comes
if
first.
he gets a heartbeat back, then obviously, then
He'd
we
still go to the
just-
hospital though,
Oh,
right? Yeah.
absolutely. Yeah, he wouldn't be able to.
That was a silly question.
You have to keep reassessing, keep making sure the
Yeah.
tube stays in place and stuff like that.
There's a lot that goes on in a short space of time.
Oh man, very stressful, huh?
Yeah. I mean, you've got to
A lot
make
of
sure
work.
the tubes are in. It's a lot of work. It's a lot of work in a short space of time.
That's why a lot of people ask, why does an ambulance and a fire engine go to a lot of these calls? And especially with a cardiac arrest type of situation, it requires this many hands to do all of this. Quite simply, if you only had 2 people on an ambulance show up at a cardiac arrest, you're having somebody have to secure an airway, an IV that is both paramedic skills. You run out of hands very quickly.
Yeah.
So it's really important that we have enough rescuers on serious types of calls that can assist, and we're all working towards a common goal. Solid?
I think so. Thank you.